ahead and start recording. So I'm sure that all of you are probably familiar with Dr. Stansberry, but just to give you some background, she's a naturopathic doctor. She's been practicing for over 30 years. She served as the chair of the Botanical Medicine Department at NUNM for 20 years, and she remains on the faculty teaching and leading ethnobotanical field courses in the Amazon. She's also the author of Herbal Formularies for Health Professionals, volumes 1 through 5. I've used those in clinic. They are such a wonderful resource, as well as the co-author of the PCOS Health and Nutrition Guide. She lives in Battleground, Washington, and is the medical director of Battleground Healing Arts, and also runs an herbal apothecary featuring many of her own formulas. So without further ado, I'll let Dr. Stansberry take it over and start the presentation for today.
Thank you so much, Ryan. I will just dive right in here. I chose the herb Colchicum for a couple of reasons. One, it might be an herb that you don't focus on much in your materia medica classes. It's not an everyday herb, perhaps, but when you need it, it can be a powerful ally. I also chose it because it is considered a prescription status botanical, and it's the source of the pharmaceutical medicine colchicine, as many of you are probably already aware. I have an ambitious list of slides here for us for just an hour's time. I have done this slideshow, as I was telling Ryan, in more of an hour and a half previously. So I've purposely hid a few slides, although Ryan has the whole collection to share with you that will go into a few more molecular details or research or more of the sort of fine-tuned molecular kind of data for those of you who are interested. I wanted to just share with you a little bit more about the history of this plant and a little bit about how colchicine, and especially the whole plant Colchicum, can be used for more than just gout. If you might have heard of colchicine as a prescription medicine for gout. The research is growing, and I think it's something to keep on our radar, in that colchicine is almost something of an anti-fibrotic, powerful anti-inflammatory, and even an immunosuppressant of sorts. Not that that's something we need on an everyday basis, but every now and then, and we'll see what those every now and thens might be. There is my apothecary website, and if you go to that website, there's a portal to contact me, as well as you can see a little bit more of my content and blog and articles. There's not lots there, but there's some, as well as the herbs and how I run my apothecary. So let's dive right into the plant itself. Colchicum autumnale, or autumn crocus. It's not a true crocus. It's kind of a misnomer, but it does look like a crocus. So aptly named just visually, and it doesn't bloom in the autumn. So it's kind of a curious name. It doesn't bloom in the autumn, and it's not a crocus, but it's the autumn crocus. It was listed in many of the old herbals, even one of the famous Ebers papyrus documents that's often referenced as a very early materia medica dated to 1500 BCE, written on papyrus paper, and it's a list of Egyptian traditional medicines. The bulbs of this plant are what is used medicinally. They're the source of colchicine that we'll talk about, and they have really been included in herbal medicine for at least 1,000 years, or way more than 1,000 if you go back to its mention on the Ebers papyrus. We'll take a look at additional uses of colchicine just beyond gout, but where we're going is to look for a number of acute inflammatory disorders, and especially disorders that result in long-term permanent fibrosis of tissues and organs. The name Colchicum derives from Colchis, which is an ancient kingdom on the Black Sea. And legend has it that one of the rulers, Aeetes, kept a golden fleece. So you might have heard in just your mythology readings, even as far back as grade school or childhood books, perhaps, that the legend of this golden fleece. the daughter of this ruler, Medea, was said to be a sorceress who made poison juices by squeezing grasses and twisted roots. And as we'll see, some of those roots are colchicum roots. One of the most potent products Medea made was squeezed from the bulbs, the underground corms of the yellow crocus colchis. At that time, Colchicum autumnale, and that is where the name comes from. And just the whole legend, Jason, the leader of the Argonauts of Greek mythology, made it his quest to obtain this golden fleece, but it was heavily guarded by dragons around the Black Sea. Jason met this princess sorceress Medea, and they fell in love. Princess Medea used her colchis poison to help Jason, moved on too quickly, to help Jason poison the warriors and the dragons that stood guard over the fleece. And these are just some of the many mythology artworks you can find dating to this myth and legend. And that is said where the word colchis comes from. Colchicum corns have been used for gout since at least 550 AD by both the Greeks and the Romans. The Byzantine physician Alexander is reported to have used colchicum. And so there it is on some stamps in a beautiful field of commercially grown colchicum in Georgia. Another very early Materia Medica was written by Dioscorides, and that's where the genus name of the wild yams, Dioscorea, comes from. We're getting some ancient history and etymology in here, squeezed in here. His early Materia Medica also includes an entry for colchicum. Much at the present time, if you look at PubMed type research, focuses on colchicine, and we often find that as herbalists. Sometimes it's hard to find research on whole plants when they're the strong alkaloid containing plants like lobelia. You can only find published papers on lobeline, or Atropa belladonna. You can usually only find published papers on atropine and so on. And that is often the case of colchicine. So a lot of what I'm going to share with you in terms of molecular research is sadly not on the whole plant. I have been using the whole plant myself, more on that as we go. But colchicine is the active pharmacologic component. It's an alkaloid. It was identified as early as the early 1800s, around 1820, and was purified and began to be studied in isolation in 1833. And then here's just more of the smattering of the artwork you can find from mythology, or just find discussing Dioscorides and some of the early authors. So colchicum and the isolated colchicine are our topics here. Colchicum extracts have been used for over 1,000 years for gout. And I mean to present a little bit beyond gout and why it would be helpful for some of these acute inflammatory fibrotic conditions. And it still is one of the drugs of choice allopathically to use isolated colchicine. Colchicine is an FDA approved drug for gout, and also was recently meaning in the last several decades, also approved for familial Mediterranean fever, kind of like an autoimmune disorder with a genetic underlying predisposition to it. And it can also be a complication of amyloidosis. In 2009, that's what I was saying, just really in the last few decades, the FDA approved colchicine in a formal way. Even though it was a legend drug for gout, it was not necessarily embraced. It almost evolved out of the herbal tradition and just kept it on those pharmacy formularies for all this time, really a century or more, and was finally approved in 2009. And that approval led to renewed interest to increase what the patent applications might be for, or what the approved drug applications and indications might be. So the 2009 FDA approval of colchicine led to new research and large studies on its long-term use by gout patients, and this has led to the development and realization of additional benefits in cancer and immunology and cardiology and dermatology. We also are finding that topical application might be helpful for bullous disorders like a pemphigus or severe kinds of dermatitis, vasculitis, aphthostomatitis, and not written on this slide, but some other kinds of contractures and keratoses and fibrotic changes in the skin. Here's just a compare and contrast between two plants that are sometimes confused. We are focusing on Colchicum autumnale on the left there that goes by the name autumn crocus, and another common name for it is saffron. And it's a little confusing because there's another plant, Crocus sativa, sometimes referred to as true saffron, and those stipules from the center of the plant are used to dry for the beautiful orange pigment and a spice. And then there's research on this type of crocus and the saffron spice for dementia and for neurodegenerative disorders and having a neuroprotective effect. And indeed, they look quite similar at first glance and very crocus-like. So let's go on just to summarize what I just went through quickly there. Some of the emerging indications for colchicine beyond gout is that colchicine is now shown to be indicated in a number of different acute inflammatory or chronic fibrotic conditions. That can be skin conditions like aphthostomatitis, bullous disorders, pemphigus, and scleroderma. Of course, scleroderma is a permanent fibrosis of the skin. Vascular conditions such as pericarditis, giving a tiny amount of colchicine for acute pericarditis might prevent long-term sequelae like permanent fibrotic adhesions around the outer tissues of the heart itself or surrounding thoracic cavity. DIC, that's disseminated intravascular coagulation and vasculitis. We'll see how colchicine has effects on blood cells. Some musculoskeletal autoimmune diseases such as Behcet and Dupuytren's contracture, immune disorders from cancer to autoimmune diseases, and in general, various kinds of fibrotic and sclerotic disorders. I also just mentioned that colchicine is now an FDA-approved drug for familial Mediterranean fever and amyloidosis that might be associated with it. And here we have in this illustration the molecule of colchicine and how it acts on reactive oxygen species in a way that limits the release or the activation or the inflammatory cascades by several different pathways that they're just here calling the inflammasome, all the different inflammatory compounds, interleukins here, but also NF-kappa B and tumor necrosis factor. And then I have a slide that will better show these polymerization phenomena on tubules and microtubules. More on that in a moment. So I won't reread this to you, but these are all of the things that colchicine might be helpful for. And we might, as herbalists, prefer to use whole plant colchicum tincture in any sort of circumstance where we're concerned that a chronic inflammatory disorder is going to lead to a permanent fibrosis. That would include cirrhosis, which is really a fibrotic process in the liver, alcohol-induced hepatitis or primary biliary sclerosis, all of those skin conditions that we just mentioned, scleroderma to psoriasis to contractures, cardiovascular conditions such as heart disease, especially acute myocarditis or pericarditis. And how does it work? We'll see specific mechanisms of action, but one of the most studied phenomena is effects on tubulin proteins and microtubulin dynamics. And I have a slide that illustrates this a little better in just a moment. But colchicine might be a natural immunosuppressant. And if you're like me, when I was a student, I thought I would never use an immunosuppressant. It was almost against the religion of naturopathic medicine to consider suppressing someone's symptoms. But it doesn't take too long to be in practice, and you see somebody who's acute rheumatoid arthritis is destroying their joints and their bones and their connective tissue. And it's going to take maybe months to heal their leaky gut or treat their stress or get them better mineralized or improve their digestion or improve their sleep. And it doesn't take long to sort of have the desire, boy, if we could just stop that awful acute inflammation, to give us a month or two. Or somebody just that's had a heart attack or acute episode of myocarditis, and you want to prevent their heart from becoming fibrotic. There are circumstances where even, yes, as physicians and herbalists, naturopathic physicians and herbalists, you might be desirous of an immunosuppressant, whereas a general course of day-to-day medicine, we tend to treat the underlying condition and avoid suppressive and use more terms like immune modulation or restoring function and building vitality. But it happens. You might come across such a patient within your clinical career. So colchicine is something like an herbal immunosuppressant. Colchicine halts the destruction of connective tissue in arthritic, dermal, and other collagen vascular inflammatory processes. Colchicine very quickly will halt white blood cell hyperreactivity, particularly neutrophil activation, and thereby reduce the release of pro-inflammatory cytokines and decrease platelet and mast cell activation. And if you do that, then you affect all the release of the cytokines, what the previous slide was referring to as the inflammasome. And what this slide is kind of looking at, these inflammatory cascades related to tubulins, and we'll go on and look at that in just a moment. So colchicum, the whole herb, versus colchicine. You might have to search to find a company that makes whole colchicum plant tincture, but there are a few that do, and I keep some on hand just in case I need it. It is very difficult to find dry plant material. You'd almost have a better chance of drying it yourself and making it. Colchicum is potentially toxic. I would put it in league with the gelsemium and aconite, and it's not a nerve poison that maybe has such a narrow therapeutic window, but it is a problem that we need to have a good dose. I see that my little video froze up there, and I'll just roll with it and unless you tell me to stop and restart the whole slideshow. I think it would unlock, but let's just see if it does on its own. It's difficult to find colchicum tincture, but it can be done, and we will talk about safe dosing strategy, but the dose is going to be conservative. So that's definitely a take home from this presentation. It's not going to be equal parts with your Crataegus and other kind of heart herbs for myocarditis. It would be a mill, up to 5 mils, maybe in a 2-ounce bottle. Or for an acute contracture or acute hepatitis, it would be a few mils along with milk thistle or curcuma. It is actually considered safe even during pregnancy, and we know that because of all of the large-scale clinical trials that have been done on women with gout who need to rely on colchicine to prevent a gout flare during pregnancy. It has been considered to be safe during pregnancy, which is almost surprising being an immunosuppressant as it is, but it is considered, colchicine anyway, safe. What was listed by Jason and the Argonauts was actually this species I just wanted to call your attention to. Besides the Colchicum autumnale, another species is also used, Colchicum luteum, and luteum means yellow in Latin. So this is the yellow flowered species, and it also contains colchicine. In the 19th century, colchicine became established, especially as a treatment for gout. An Italian pathologist reported colchicine to produce lesions in the nuclei of gastric and intestinal cells of treated animals and to interrupt cell mitosis, and these cells would be arrested in the metaphase. So it's kind of an anti-mitotic agent. And so immediately you might make the leap, aha, I see why it might help cancer as an anti-mitotic agent. In 1967, colchicine was realized to block the dimeric building block of microtubules, the tubulin protein, and this is how it interrupts Mitosis is it blocks the little threads that pull the chromosomes apart and will arrest cells in the metaphase. And so the microtubules not only play a role in mitosis, they also play a role in cell signaling and immune modulation, which is why they have other immune modulating and possibly anti-cancer effects. Despite the long history of medicinal use, colchicine was only recently approved, 2009, as a recognized drug for acute gout flares. Research in the 50s and 60s revealed colchicine to affect the microtubules of the cytoskeleton, and we've since realized that this not only affects mitosis, interrupting vesicular trafficking, affects cellular structure and dynamics as well. Colchicine is an immune modulator. At a big enough dose, I would even put it in the league of an immunosuppressant, as I said before. By binding to tubulin units, colchicine can be toxic, and that's why a little bit will halt an inflammatory or a perhaps cancerous process, and too much can be very harmful to other rapidly dividing cells, almost like chemotherapy can be harmful to rapidly dividing cells. Colchicine can be toxic to cellular growth and replication. Yet in rapidly dividing, excessively proliferating, and hyperreactive cells, colchicine can suppress inappropriate immune reactivity. And so here's just again some other slide listing of the clinical indications for those acute reactions: Behcet syndrome, acute systemic inflammatory disorders, the Mediterranean fever, in addition to gout. It was also on the radar the last few years as a possible treatment for SARS-CoV because all of that excessive inflammation, the cytokine storm, and yes, we saw pericarditis and myocarditis, and we saw vascular hyperreactivity, and we had COVID toes and clotting, and so many different systemic acute inflammatory disorders that it caused people to think of, what about colchicine? And a few clinical trials were done. And here's just an image that I pulled out of one of the published papers over just the last few years showing similar mechanisms affecting that inflammasome, the tumor necrosis factor, the interleukins, and reducing inflammation. Colchicine absorption, this is worth mentioning because we do have a narrow therapeutic window. So somebody with liver or kidney damage would be requiring a lower dose or greater monitoring by us. Colchicine is absorbed in the gut. It becomes distributed throughout the body tissues, absorbed in the jejunum and ileum primarily. It is metabolized by cytochrome enzymes. So any drug that also utilizes cytochrome enzymes, we might need to be thoughtful about. Another slide on that is following. Colchicine is excreted from the body via the liver, hepatic clearance, biliary system. The half-life is between 7 to 9 hours. So typically it's dosed about every 8 hours. And caution, therefore, must be used in people with liver or kidney disease as they might not clear it as readily. Colchicine is typically dosed at 0.5 milligram, and that's the typical pharmacy dosage. If you would send somebody to the pharmacy for a prescription of colchicine, rather than using your Colchicum tincture, it would be in this tiny range, 0.5 milligram. And only occasionally do people go as high as 1 milligram. That might be a loading dose for acute inflammation and then ramping right back down to the 0.5 milligram. It started to be available as IV, but it was withdrawn by the FDA following a few fatal reactions in some people when it was too harsh or too quickly administered. Formerly, colchicine was thought to be completely absorbed, but now we think it's about 24 to 88% absorbed. The exact site is unknown, but the jejunum and ileum are known. And those bowel regions are often affected or the site of overdose. And then this slide shows the dose for acute gout, 1 to 1.3 milligrams is just a single one-time dose. And then you follow with 0.5 milligram every couple of hours until the pain is relieved. And then people that just get gout constantly, sometimes people are left on colchicine at 0.5 milligram once a week up to 3 times a day, kind of ramping up and down as a maintenance dose, or as soon as they feel the warning signs of some pain coming on, might take it 3 times a day. And they've done that long term. And those were some of the safety, pregnancy and long-term use studies come from. Colchicum tincture might be hard to find, but there's a few companies that make it, and most herbalists always prefer the whole plant. I certainly do. I don't use lobeline, I use lobelia, and I don't use atropine, I use Atropa belladonna, as there's many other constituents in the plant that often temper some of its toxicity or are often synergist to absorption and have their own medicinal effects. So sadly, I can't cite a lot of those studies for you, but I have been using whole plant colchicum for some of these Behcet syndrome or pericarditis, and they only come along once a year or so. So I can't claim I have vast experience, but I think it's an important plant for us to know about, and the research is becoming more and more robust. So let's take a closer look at those mechanisms of action. Colchicine binds to non-polymerized tubulin, forming a tubulin-colchicine complex. So there are those little dots there, the red dot and the green dot in this illustration. Tubulin will polymerize, meaning many will bind together and create these elongated fibers or strings that, yes, contribute to the mitotic process and pulling the chromosomes apart, but also microtubules fill up intracellular spaces and between cells and create the so-called cytoskeleton is made of tubulin proteins. So if colchicine is able to bind to those little units, we interfere with the ability of tubulin to kind of elongate and contract and remodel and rebuild itself in a dynamic process. Colchicine can bind the tubulin molecule and inhibit its polymerization into microtubules. Whoops, I went backwards. Colchicine disrupts the microtubules in a dose-dependent fashion. This is an awesome staining technique that is an actual cell, not an illustration, where they have a special dye that has an affinity for microtubules. So what might be invisible, usually when we look at cells, we look at their mitochondria or their Golgi, or the lysosomes and the nuclei and different things. But this is a staining technique that allows us to see how cells are filled up with microtubules. So not only are those involved with the mitotic process, they also are involved with signal transduction, gene expression, cell movements, and in this way, colchicine can affect neutrophil, chemotaxis, white blood cell, engulfment of different cells. And if you've seen any of those kind of real-time videography of white blood cells where they'll ingest a carbon particle or attack a bacteria, they almost move in an amoeboid kind of fashion. They move because of their self-organizing abilities directed by the microtubules. So colchicine has a real affinity for blood cells since they have such great movement to them, supported by the cytoskeleton. It was previously claimed that colchicine's mechanism was solely due to tubulin's effect on mitosis, but now we know that's just a small bit how colchicine affects the whole cytoskeleton and how the cytoskeleton plays many important roles in signal transduction, gene expression, migration of cells, secretions of different substances in and out of cells, cilia, flagella, actin fibers, etc., can all be affected by colchicine because all of those are in part directed via the cytoskeleton. So colchicine especially has an affinity for leukocytes and neutrophils. Colchicine inhibits several leukocyte functions such as adhesiveness, amoeboid motility, mobilization, and granulization of the lysosomes. However, the most potent effect of colchicine is on white blood cell chemotaxis. And that's, of course, what is so helpful in gout. The uric acid crystals are sort of a disease in and of themselves, but as the white blood cells migrate to that area, as chemotaxis allows all the white blood cells to rush to the area and cause acute swelling and redness and pain and pus collection, if we just halt that a little bit or slow that down so the body can digest those uric acid crystals and kind of help move them out through the lymphatic channels and circulatory networks, maybe it's not quite as acutely painful or as severe or a shorter episode. So we can understand why colchicine is so helpful for gout. Colchicine decreases the expression of adhesion molecules on neutrophil membranes, leading to significant inhibition in migration and interaction with endothelial cells. This is why it also might help some diseases that have aberrant clotting, platelet adhesion, heart adhesiveness, like the fibrotic processes of pericarditis. Other investigators have shown that colchicine may modulate cytokine production by polymorphonuclear cells. Colchicine disrupts, this is kind of a summary of what we've just said, colchicine disrupts microtubule structure and reduces neutrophil elasticity and relaxation, thereby preventing extravasation from the blood vessels to the site of inflammation. This may be the final and most effective step in inhibiting chemotaxis. A high concentration of colchicine will also suppress phospholipase, and that's involved with phagocytic activity. Conversely, colchicine does not exert its anti-inflammatory effects through cyclooxygenase, so it's not really just simply a prostaglandin inhibitor. Colchicine reduces the generation of tumor necrosis factor and its receptors on endothelial cells. And that's another reason why they were looking at it for COVID infections, because so much of that that acute inflammation was highly vascular, heart inflammation and blood vessel inflammation and acute clotting disorders, and almost like a DIC, a disseminated intravascular coagulation that happened abruptly and acutely and severely. So looking at steroids to suppress that from happening, and looking at colchicine as an immunosuppressant with an affinity for blood cells. Colchicine also suppresses inflammation by inhibiting superoxide. Superoxide, as you might have studied in your other classes, is one of the more potent antioxidants. I believe I've read something that a single molecule of SOD can take care of some 100 different free radicals, where typically what's thought of as our antioxidants, vitamin C and vitamin E. It takes one molecule of vitamin C to mitigate one molecule of a free radical, where SOD can absorb lots of charge and keep absorbing or keep refueling or protecting itself. So it's way more powerful than our sort of nutritional vitamin E, vitamin C, selenium, zinc kind of antioxidants. So it's one of the most potent, which is why they call it superoxide dismutase. Colchicine inhibits superoxide production at 100 times lower than that required to inhibit neutrophil infiltration. So it's a highly powerful anti-inflammatory agent. And then I've been alluding to the anti-fibrotic effect. Colchicine can limit the infiltration of fibroblasts in the liver, in the kidneys, around the heart, in the skin, chronic inflammation, acute inflammation. So that's one thing to remember. Any kind of pathology that you might be treating, you could consider colchicum tincture topically. You could consider a tiny little bit of colchicine in a formula for hepatitis, for Behcet syndrome, for collagen vascular disorders. And there's just another artist rendition of there would be uric acid crystals and inflammation that's triggered, and how colchicine affects endothelial cells squeezing through blood cells and white blood cell recruitment and superoxide support. Just a review of the dosing. It's actually relatively safe as long as you keep it within the right dosage window. It's shown to be well tolerated when dosed at least less than 2 milligrams per day in children and 3 milligrams per day in adults. And as we saw, typically we're only giving 1 milligram a day, and that's pure colchicine. So that would be perhaps a little more of the whole plant tincture that would only have micrograms of colchicine in it. Colchicine dosing needs to be adjusted whenever someone is on a drug that also compromises liver function, or an elderly person with compromised liver or kidney function. The side effects for overdose are abdominal cramping and pain as peristalsis is interfered with, or hypermotility at first with diarrhea and shuts down later. Severe side effects are usually transient, and people prevent that by giving divided doses. If you had a severe inflammatory reaction where you wanted to get to the 3 milligram range, and I don't do this, but just the studies show that you would give 1 milligram in divided doses to build up to your 3 milligrams, and maybe that would save somebody's heart who had myocarditis, and then you ramp them back off in just a couple of days, for example. Leukopenia is very rare, but does occur, and neuromuscular complications can occur, especially if there's concomitant drugs on board, and I have a list of those following. So this is just another slide share that I found online looking at drugs for acute pericarditis: aspirin, ibuprofen, and colchicine, 0.5 milligram a day, kept up for 3 months long-term to prevent the fibrotic process. And as we said, a typical dose is 0.5 milligram to 1 milligram at a time, never to exceed 4.8. I would not exceed 3, and I probably would just be using whole plant tincture, but maybe every once in a while, 0.5 milligram of colchicine. One clinical trial evaluating colchicine for gout patients found a loading dose of 1 milligram followed by 0.5 milligram every 1 to 2 hours was effective in reducing acute pain, but that GI upset was common. Millions of people use colchicine and have safely for years without significant side effect, including ongoing for years on end without significant side effects, making us think that colchicine, when used properly, is fairly safe. It's even safe in children and toddlers if they have some sort of acute inflammatory disorder, for example. It's even been found to be safe during pregnancy and nursing, provided that the person has normal renal and hepatic clearance. Colchicine rarely causes oligospermia, but does not affect sperm motility. And there's just another slide I found online. So you can tell by all my graphics how many different slides or research papers have been published that I'm borrowing some of the graphics. Here's efficacy and safety of low dose colchicine after an MI, and looking at safe dosage ranges. And colchicine improves the heart rate and the stroke volume, et cetera, in the recovery, the convalescent stage following a heart attack. Colchicine overdose has the symptoms shown in the little box there at the right. It can lead to a cholera-like syndrome with extreme loss of fluids, dehydration, shock, multiple organ failure, DIC, disseminated intravascular coagulation, seizures, coma, and death. That's with an overdose. The doses of 0.5 milligram at a time are safe, and this is saying 0.5 milligram per kilogram, like some of those rat studies where they look at the toxic threshold is highly toxic, and the lethal doses are when they push it even further to 0.8 milligrams per kilogram. The lowest reported oral dose that has been associated with toxicity was 7 milligrams given over 3 days in a 39-year-old man. And I believe that was with liver compromise. And that was one published paper. Colchicine toxicity is associated with GI symptoms first. If you don't let up the dosing at that point in time, it will proceed on to organ failure and arrhythmias. And usually, even with that severity, people can recover if you stop giving it. Patients surviving are generally reported to recover. Some will have a rebound high white blood cell count as the organ failure resolves. Drug interactions are something to be on the lookout for. Because colchicine is metabolized by cytochrome enzymes, other drugs that are metabolized by or agents that inhibit cytochrome enzymes can increase the toxicity of colchicine. Macrolides, HIV drugs are on that list. Statins are not on this page. I think they're on an upcoming page, are also to be used with caution. Patients using such drugs need a lower dose of colchicine to prevent toxicity. Colchicine can also alter the absorption of those compounds, and so you might need a higher dosage range of some drugs, or I think as naturopathic physicians, we would consider liver support and digestive support. So I won't read you this, but this is just out of one of those papers on what drugs interfere with colchicine for gout patients. And I'll list there are some antibiotics and anti-inflammatories, some anti-cancer drugs, et cetera, and what to be on the lookout for. And then that's my summary of looking out for these drugs. The use of the following drugs may increase colchicine levels 100-fold, which would obviously be problematic because they're interfering or they're taking up some of the liver's cytochrome enzyme processing systems. So colchicine is left unfiltered and you would achieve a higher blood level over time, which could be a problem. Colchicine can alter absorption from the intestines. Colchicine may impair the absorption of B12. Colchicine can induce lactose intolerance, especially in patients with familial Mediterranean fever, perhaps a concomitant genetic tendency. Colchicine may also reduce iron absorption in patients with familial Mediterranean fever. Colchicine is the standard of care for gout. Now we're getting into the home stretch where we'll just review a couple of therapeutic scenarios. Gout, of course. Gout is characterized by acute attacks, often so painful people can hardly move the joint. It's excruciatingly painful due to the accumulation of uric acid, and gout can be improved in so many of our naturopathic ways, supporting renal clearance of uric acid, working on gout, or working on diet and working on hydration, etc. But in addition to just simply being acutely painful, people that have chronic gout episodes are known to be at an increased risk of cardiovascular disease and heart failure. Just probably relates to inflammatory burden in the body and attests to its association with metabolic distress. And there's some of the worst cases of gout that you just get if you Google gout and uric acid crystals and tophi. And we have lots of herbs that we know enhance the excretion of uric acid. So I would use some of these herbs along with a pinch of colchicum. There's a sample. Those herbs that were on the previous slide, with 2 mils of colchicum in the tincture. That can be dosed as often as every 30 minutes for half a day, and then for an hour, and then for every 2 to 3 hours. Excuse me, ramping down as symptoms improve over 3 to 4 days. Colchicum has also been found to be helpful topically. Topically on those skin contractures like Dupuytren's contracture or actinic keratoses, or even cancerous lesions, and which actinic keratoses can be precancerous. So here's an example of something to use topically on gout. It even hurts to touch gouty toes and areas. So this is laid on very gingerly, but colchicum tincture, cayenne oil, camphor essential oil, mainly to be pain relieving and that nice numbing quality of those herbs. And you just make a paste with a little ginger powder, whisking it all up and putting it on topically 3 or more times a day as a concomitant pain relieving idea, along with your internal or oral medicines. We mentioned several times familial Mediterranean fever. I don't really have time to give this justice, but it's caused by an abnormal neutrophil action that releases more pyrin that relates to this fever name. It makes you hot or have episodes of febrile states, and there is a genetic predisposition. It's sometimes called the great mimic because it's often missed. People might think they have arthritis, they might think they have peritonitis, they might think they have just a gastric problem or gout or something as well when it's an acute onset of a joint pain. Inadequately controlled FMFs can develop amyloidosis, leading to chronic renal failure. Colchicine has been found to prevent the emergence of amyloidosis. And here's some of the actual patient photos with a rash-like and acute febrile state, the sore joints that erupt, familial Mediterranean fever. You can Google on your own, or perhaps you've covered it in classes already. And abscesses can sometimes form, or more likely just these acute painful joints. Since the 1970s, colchicine has increasingly been shown to be effective in reducing the frequency and the severity of the febrile or inflammatory or arthritic kinds of episodes. And it can also prevent the development of amyloidosis. However, colchicine is not effective in controlling attacks when administered once they occur. It's more something you take long-term to get control and reduce the severity and the frequency of attacks, unlike gout that you might take right at the time of an attack if it's your first one, and it would help. In 1997, a gene was isolated, and hence the familial aspect of this was further studied. And this is just a sample of a couple papers: colchicine treatment in children with familial Mediterranean fever, current trends in colchicine to treat familial Mediterranean fever, and a little bit about pyrin. I'm going to skip that. Going on to colchicine for Behcet syndrome. I have seen about 3 cases of this in 30 years, so about 1 a decade. But when you see it, you might really want some colchicine on board, or any other autoimmune condition that has severe vasculitis, episodes, fibrosis. It's an autoimmune condition involving systemic vasculitis, and many of the autoimmune conditions can have vasculitis, but there's more papers published specifically on Behcet's. We can have multiple organ failure if the vasculitis is so severe to impair kidneys or joints or lead to scarring of tissues. It's unknown exactly why it affects the genitals and the oral cavity more so than other body parts, but probably due to an HLA tissue type affinity on those tissues. It affects men more often than women, usually younger people in their 20s and 30s, and less often occurs in later decades in life. The oral lesions are often kind of characteristic and always occur in conjunction with the genital lesions and joint pain. So if you see that duo trio, it's certainly worth considering Behcet syndrome. It can also affect the eyes, and around a quarter of those afflicted can have serious vascular and neurologic lesions, and it can even be fatal if the vascular effects are so severe as to lead to an aneurysm or a severe thrombotic event or a heart damage. And so back to these ideas of colchicine being able to inhibit fibrosis. Corticosteroids are often used by immunologists but can be, of course, undesirable, all of the long-term consequences of relying on steroids. And colchicine might help be an alternative to steroids, or just help steroids be for an acute course only and not long-term, or might help reduce the required dosage of steroids to get this under control and to heal the skin, the genitals, the mouth, and to protect your eyes and your heart. So colchicine has been established in a similar dose, 0.5 milligram, 3 times a day for a period of months, sometimes longer if the acute flares persist. And here is an example of an herbal approach that uses things that are protective against the inflammation in the skin, on the nerves, on the eyes, in the lymph and the vasculature. And we don't really know in many cases what causes an autoimmune flare, but most of the going considerations are that a microbe, a virus, or a toxin causes the body to mount an immune response, and then it goes haywire due to this HLA tissue type and affects those particular tissues. So here we have just an immune modulating tincture to which we might add colchicum, or to which we might complement with a colchicine prescription. And then I'll make it in just the nick of time here in our allotted time, colchicine for other inflammatory disorders, bullous skin disorders. I've seen many of these types of cases, often on the hands and the feet, and they often will persist for months. And extremely pruritic for many people, just itch like crazy, and then big areas of skin flake away. Definitely, I would put colchicine in somebody's tincture. And we're usually treating them systemically in the gut, in the bowels, and the diet. Colchicine topically is available as a 1% ointment, and it can be prescribed for these precancerous lesions. Excuse me, my voice is tiring here, but it often is capable of inhibiting the cellular proliferation when it's applied topically. So for elderly patients with these precancerous lesions, you could send them to just a regular pharmacy, depending what state you practice in, if you have prescriptive authority, or you could make up something if you don't. You could put colchicum tincture, whip it into some kind of an aloe gel or something of that sort, and apply it topically, or send somebody to the pharmacy. So any kind of fibrotic, keratotic lesions, it would be considered a possibility. Scleroderma, of course, which is severe sclerosis, fibrosis of the connective tissue of the skin. You could include it in your oral tincture. You might make a hand soak or castor oil with a little bit of colchicum tincture in it. Amyloidosis, you can have amyloidosis for reasons other than familial Mediterranean fever, but we did talk about it in that patient population specifically. But amyloidosis is a group of diseases where abnormal amyloid will build up in the tissues. And there's several different types that we won't go into, kind of minor types, and then severe types, which cause bleeding and splenomegaly and lesions in the lungs and so on, that could cause a person to have a fatal case of pneumonia or something if they get a bad winter bronchitis. So colchicine is a possible therapy to try to reduce the progression of amyloid deposition in the tissues, and might even be able to help existing lesions to regress. And that's where the new FDA approval has led the way to renewed interest to see what other diseases the drug might be approved for. And there's ongoing clinical trials for amyloidosis at the present time. Doses of 1 milligram per day might also be used for contracture, or if you find one of those ointments for plantar fasciitis, Dupuytren's contracture, or any kind of autoimmune destruction of the tendons, or following a burn or an injury, some of those severe contractures. I had a patient just a couple years ago with Dupuytren's contracture, and we made an ointment with gotu-kola oil and colchicum tincture and a little bit of castor, and put a number of just kind of my best ideas together, and it regressed. And so here's something that I did for that person, or I would consider: castor oil, colchicine gel. You could get a prescription retinoid, a vitamin A cream, St. John's wort oil, that's Hypericum perforatum, vitamin E, vitamin D, just the good skin oils would be a topical, and then complement that with something by mouth: curcuma, Hypericum, Colchicum combined, certainly lesser amounts of the Colchicum. Chronic hives might also respond. I'll just skip that quickly for now. Aphthostomatitis, whether it's Behcet syndrome or just your run-of-the-mill canker sores. We don't usually need colchicine for your run-of-the-mill canker sores, but if it is an underlying autoimmune disorder, lupus, connective tissue that's affecting the mouth, the eyes, the skin, then I would consider colchicine. Here we have Colchicum autumnal, a lot of it put into licorice as a solid extract. So our dose would have to be quite low of that. A little paste that you would hold in the mouth or shake a bottle vigorously, and that would be very thick to kind of thickly go through a dropper bottle. And you would want to hold that in the mouth before swallowing. And you might have to do your math depending on what kind of product you find to quantify how much colchicine a person is getting in any one dose. So there's also been looked at colchicine as a possible cancer preventative for obvious reasons: if it interferes with mitotic processes, if it's immune modulating, if it affects white blood cell activation. Some findings are looking at or investigating colchicine for chemoprevention or a possible adjuvant in chemotherapy. And some of that chemoprevention, again, came from those gout studies where they followed hundreds, if not thousands of people for years on end that take colchicine for gout, and they find there's lesser incidence of some or many types of global cancers in those populations. Research has been on isolated colchicine rather than colchicum tincture. The study reported lower incidence of all-cause cancers in colchicum ever users compared to colchicum never users, especially significant for prostate and colorectal cancers. So I made it through our material in the nick of time. I do cover more information about all of these conditions, as well as some write-ups on materia medica in my textbook series. There's volumes 2, 3, and 4 that are available from the publisher Chelsea Green, which is a wonderful, actually green company that's employee owned and was a good experience for me. And once again, you can find me through my apothecary. So thanks so much for having me, herb students, and I wish you happy trails in your herbal careers. And sorry, my little talking pane locked up. I'm smiling at you.
Thank you so much, Dr. Stansberry. We're so grateful you've been able to present today. And thank you to everybody who's able to join us, and to Crystal for getting this set up for the club. Thank you again.
Thank you very much. That was amazing.
You're so welcome. Thank you, everyone. Have a great day.
Thank you.
Thank you.
Bye-bye.